You might enjoy a nice lemonade or squeezing fresh limes into your favorite drink during the hot summer months, but getting those juices on your skin before heading out into the sun can leave you in danger of developing a painful skin condition. It's called Phytophotodermatitis. And dermatologist Dr. Doris Day is here with more information. Hello, Dr. Day. It's great to see you.
Great to see you too.
So tell us exactly, what is Dermatitis. Sorry, it's quite a mouthful.
What's so great about it is that it's a very descriptive title. So phyto means plant, photo means sun, and dermatitis means rash in the skin. So it's a reaction to a plant and then exposure to sun afterwards that creates a very distinctive rash and actually very itchy and painful reaction in the skin.
So you might not have the reaction to the plant if you had not gone out into the sun, or does the sun just exacerbate it?
No, it has to be plant plus sun.
Okay.
So the plant alone or sun alone won't create that reaction. It's the combination of the two.
And what sort of rash develops?
Well, it can be anywhere from 1 to 2 days after the exposure that you begin to see the rash. It's a painful, red, blistering reaction, and anyone exposed to it will have this reaction. So it's not an allergic reaction, it's really a toxic reaction. So enough exposure to that plant element plus some sun exposure, and again, it's a matter of how much sun exposure, and these are common plants that we're talking about, can create this reaction that might last for weeks to even months. And it can be a real problem.
And is it painful as well as unsightly?
It can be very itchy, and if it blisters, it can even be painful, and then it can get secondarily infected. So once you have that open, exposed skin, then that skin is more prone to infection, so you can have complications after. And one of the biggest problems is that it can leave the skin discolored.
Ooh,
so sometimes you may not get so much of a rash, but we see discoloration.
And what are the plants that can cause this?
Very common plants, things like parsley, parsnip, carrot, celery. So if you have that Bloody Mary the morning after outside in the sun,
yes,
for that brunch, it can be from the celery. Lemons and limes are probably some of the most common plants and fruits that can cause this reaction.
So with lemons and limes, it makes sense. You've got the juice, but the celery, for instance, is it just enough to touch the celery to your skin and then go out into the sun?
Well, it depends on the time of year and the celery. So the older the celery, then the more of that ingredient it has that can create that reaction. So it's an element that is common to all these plants and fruits that exposed to the skin, what it really does is it makes your skin exquisitely sensitive to light. So they're light sensitizers. And we actually use some of these elements in medicine to make people more sensitive to light if they have a condition like psoriasis. So we put it on their skin, wait an hour so that their skin is sensitized, and then put them in a light box to make them have that reaction. So in a controlled way, it can be okay. But the other thing is that it's not all wavelengths of light that does this. So in the summertime, we have more of the UVB, the shorter wavelength. In the winter, it's more UVA, but it's the UVA wavelengths that does it. So it's just that people are outside more. It's a longer wavelength of light. So it doesn't have to be in the middle of the day. It could even be in the morning or in the afternoon that you're out. You have this plant on your skin, so people who have fruit juices, it can happen too.
And can it happen to anyone, or are certain people more susceptible?
Because it's a toxic reaction, anyone who has enough exposure to that element plus enough sun exposure in that UVA range, and it goes through clouds. So even on a cloudy day, it can happen too. And then you can tell if someone's a lefty or righty. If they were squeezing the lemon with their left hand, you might see the rash on their left hand.
Fascinating. And now this is not an allergic reaction, so it has nothing to do with the type of reaction we see from poison ivy or poison oak, correct?
Correct. This is a phototoxic reaction, meaning anyone exposed to enough of the plant or fruit and enough sun will have this reaction. So any skin type, any age can have this. And even in children sometimes, if the parent had it on their hand and then they put the hand on the child, they may think it's child abuse because you may see the red outline of the hand.
Oh my goodness.
So yeah, it can be confusing, and it happens a day or so later, so you may not associate it with that sun exposure.
Yeah, the timing can be tricky. So how often do you as a dermatologist see this condition? Is it very common?
We do see it pretty much every day, especially in the summer months when people are outside and these fruits and vegetables are, very commonly exposed. And sometimes it can be from some types of grass as well. So just kids rolling around depending on what kind of grass they're in. So it's a lot of very common plants that have these elements that can make you sun sensitive. So we have to kind of think broadly and be a little bit of medical detective to find out what the rash is.
Absolutely, especially because of the delay. I'm sure you get a lot of patients coming in saying, I have no idea what this is and why I have this rash. What is the treatment for it?
So the treatment is antihistamines like Benadryl, which is over the counter, and sometimes prescription strength. If it's a very active rash, we may even have to do oral prednisone or prednisone pills, which we hate to do, but sometimes we have to. Topical corticosteroids, usually prescription strength, can be helpful. And then once you have the discoloration, we have some brightening agents that can help minimize that.
Will it go away eventually on its own, or do you need this? You need these treatments?
It will clear eventually on its own, but oftentimes the treatments really help it clear so much faster. And so it is helpful to see your dermatologist, one, to make sure you get the right diagnosis, make sure it's not secondarily infected, and then know what the ingredient is that's causing it so you can avoid it in the future.
Absolutely. And does it last without treatment about a week, and with treatment a little bit shorter?
It can last a week to 2 and even longer.
Ooh.
And the discoloration can last for months.
Oh.
So that can be a problem. And with treatment, it can be a milder course. So even if it lasts a week or 2, it'll be less active, less irritating, and less prone to infection.
And finally, are people with sensitive skin more prone to getting this?
People with sensitive skin may need less of an exposure with less sun in order to have the reaction, but really anybody exposed, it's just a matter of time.
All right, Dr. Doris Day, thank you so much for that fascinating information. Be sure to visit the health page of abcnews.com for more health and wellness news.